Hi, and welcome to our latest edition of Facebook Live. I'm your host, Jennifer Williams, and we are joined today by Dr. George Raptis, Director of Oncology Services for the Northern Region of RWJBarnabas Health and Rutgers Cancer Institute, the state's only National Cancer Institute designated comprehensive cancer center. Today, we are going to talk about our growing oncology team and the brand new 137,000 square foot Melchiorre Cancer Center opening in the coming months. It's an exciting time at Cooperman Barnabas Medical Center, and we are so thrilled to care for you and your families. So, if you have a question for Dr. Raptis, please leave us a comment below and help me welcome Dr. George Raptis. Hello.
Thank you so much, and it's a pleasure being here with you and our audience, hoping we can have a conversation and inform them about the great things that are happening here, and also perhaps in cancer in general.
Yeah, and we are so glad to have you, and we thank you so much for taking the time out today. So let's just jump right in and tell us about the work that you do here at Cooperman Barnabas Medical Center and RWJBarnabas Health and Rutgers Cancer Institute. You work everywhere.
It seems like that
You've
sometimes.
You've got it all covered.
So I'm a breast cancer medical oncologist. That's all I've done for 35 plus years. Work in academic centers like this, doing clinical care, research, teaching, community service, and that's what I do here. My other role has always been, over time, different administrative roles that are helpful to health systems and hopefully translates to the community, because my job is to also build better cancer centers, integrate them across geographies, as health systems now are very broad, and to deliver the same exact care anywhere within a health system. And that's how I define systemness and quality, being able to do that and to integrate research and bring it to the local communities, because research is not apart from cancer care, it's part of cancer care. And when you can deliver on that, you're helping the person that you sit knee to knee with in an exam room, but also for me, patients and people I may never meet. And I and others also work to do that for the people we serve in other communities beyond where I sit.
I love how you said that. It's apart.
It's actually the way I view it.
Yeah, it's really. And so around here, we're very excited. The brand new Melchiorre Cancer Center is opening in the coming months. Tell us what this new cancer center means for patients and our community.
Gladly. There's great cancer care that's delivered in this community right now. There are people who come out from surrounding communities to seek us out. We have wonderful medical oncologists, surgical oncologists, radiation oncologists, and others that participate in the care. For now, what that means, though, is that patients travel from my office to the radiation oncologist's office to another building, or down at ambulatory care center for the surgeons or for the radiologists. And it's inconvenient. It's not only inconvenient for the patients, it's not great for the physicians either, because even though we communicate a lot, we have to pick up the phone, we see the patients at different times, we work together in committee meetings and on tumor boards, but really it takes extra effort from the patient's perspective and our perspective to deliver care seamlessly. We do it, it takes extra time and effort. If you can imagine bringing all that expertise under one roof, where I sit next to the breast surgeons, or somebody else sits next to the surgical oncologist, and down the hall from the radiation oncologist, we bump into each other. Patient comes into the same building, can see all the people that are involved in their care. And it's easier for us to plan how we deliver care more efficiently to the patients and their families. And the center itself, if one enters it, it's just a healing environment. It produces a cultural change for us and for the communities that we serve, and how we can deliver care and how we welcome people, and the services, not just treating cancer, but providing wellness services beyond what we're able to do, and making it a home for the patients, a place that they feel welcomed and that's part of the healing process. I believe that Melchiorre will be doing all that. I have every confidence. Yeah. And it's an amazing place.
Yeah, it's really going to help transform cancer care here in the North, and just part of a bigger investment we have as a system. And just to talk a little bit more about the team, like we've recently expanded our oncology team. There's 17 of you. How will this help you all continue to provide that excellent compassionate care to patients, and maybe you can kind of go into a little bit of the different services that we do offer here.
It's a big
It's a
question
big
to
list.
answer,
It's a big list.
but it comes down to the following. It's not just the Livingston community, it's across New Jersey. The Rutgers Cancer Institute and RWJBarnabas Health have made major investments to improve the care of patients with cancer and those at risk for cancer throughout the state. That may sound grandiose, but it's actually a commitment that I've noticed when I came here that's actually being implemented by virtue of opening several large centers, and I'm not going to speak about each and every one of them, but what does that mean? Physicians want to come to work here.
Yeah.
They see the culture, they see the access to cutting edge care, they want to be part of it. And so for now, because of the Melchiorre opening up and the Rutgers Cancer Institute, we've attracted many more physicians who have come in the last year. Yeah. And going forward, we continue to get people who want to be here and be part of this, which is exciting for me because we want those physicians and the people that support them. So what does that mean? It means that now we've always had physicians, I should say, who specialize in certain cancers. And most physicians have seen 2 or 3 or 4 cancers, all of them. But cancer is becoming more complex. The knowledge base is increasing. The nuanced care of individual cancers continues to evolve. And where we have moved and are moving with a lot of these physicians who've been recruited and have come here are people who have an interest in 1 or 2 or 3 cancers, and they're really subspecialists. I believe that nuanced care is really where oncology is going, and we're blessed to have that here. So we have people who are specialized in breast cancer or gastrointestinal cancers or focus on urologic cancers or leukemias. And that allows those patients to get that specialty care, that nuanced care, but also access to clinical research. It's easier to give clinical trials to patients when you are expert in that disease. So it's a whole package of bringing these physicians here. It expands the expertise and the kind of care we can provide to people in the community.
And I don't just say this as someone that works here and gets to work with a lot of you, and I'm privileged to work with all of you, but they are some of the best out there, and they're all so kind and compassionate, and you all bring such a welcoming spirit. And people speak so highly of all of you. When we read these patient stories and they talk about how the care you've given and you feel like family and they feel at ease. I think when someone's going through something like that, it's just everything.
I will speak about my colleagues.
Yeah.
And I've been in many places over the years, and I've traveled broadly looking at the kind of care delivery that goes on. I think providing care is challenging, and it's what the minimal requirement. But I always say it's not only about providing care, but providing caring. They're different. Yeah. And it has nothing to do with me, but the community of physicians, the ecosystem here at Cooperman Barnabas Medical Center, right? And evolving cancer program here. I think all of this has come together, and the people I work with are some of the most compassionate, truly compassionate people I have. I can pass by somebody in the hallway and they have their hand on the patient's shoulder. They're getting a hug or giving a hug. They actually worry about their patients. I can see them calling them on their cell phone as they're coming in. I know the patients really appreciate that because I see those comments. And it's not only important for the patients, it's important for us when we can develop those warm relationships. And part of it is because we're treating patients, our neighbors, families like our own in the community where many of the physicians live. And I think that creates an extra bond, and I think that's part of it. And I'm actually privileged to be part of it.
It's so special. And I wanted to go a little bit more talking about research, together with Rutgers Cancer Institute, which is the state's only NCI designated comprehensive cancer center. That's a mouthful for me, everyone. I'll just be honest, we've been practicing.
NCI designated comprehensive cancer center.
Professional. We provide, our partnership provides access to the most advanced cancer treatments and trials and so many things. Can you explain what that means and what that designation means and why is it so important?
We use it a lot, and it's important because it is not just something you apply for and as a checklist and you get it. It is, there's about 50 or so, 53, 54 such centers in the country. Many centers submitted applications, which are just basically NCI designated, NCI grants, National Institute of Health P30 grant, and it requires a lot of an organization to be able to get such a grant. That's what it is. It requires long-term commitment to provide bench to bedside to patient to population-based research. They want to see that organizations have a commitment to the continuum of developing new knowledge that actually touches patients. That sounds simple. It's very hard and complex. They need to see that there's interactions between scientists and clinicians, both for cancer care, but also cancer prevention as part of it. We have to demonstrate that continuously. We have to show that we can enroll patients on clinical trials that are changing the paradigm for care. That is essentially the mission. We cannot sit still, and we have to show that what we do in such a center actually does change the care that we provide. And there has to be organizational support, which sounds easy, but very strict criteria that shows the whole organization, wherever it is aligned with these goals. So it is something that hardly ever happens. So many other centers apply for it, but ultimately it provides also resources to foster these interactions and the research, and it attracts physicians and scientists. It creates a culture that can get all this done. And I'm gushing over it because I've been in places that have NCI designation before coming here and others that don't. And I can see a big difference. So we say it a lot, but it shouldn't be considered trite. It actually shows a depth of commitment and a culture and a desire to make things better for the patients. And it's a wonderful thing that we can do that in so many parts of New Jersey. It's something that I'm personally very proud to be part of.
Yeah, and that along with, and you kind of touched on this a little bit before, you know, the Melchiorre Cancer Center is part of this larger investment in cancer from the system, you know, with the Jack and Cheryl Morris Cancer Center that's now open in New Brunswick, and the Specialty and Cancer Care Center at the Vocal Medical Campus in Tinton Falls. So being a part of that, being a part of this investment, how does that make you feel, and how does that impact like our entire state, not even just our little community, but why is it so important? Because kind of like you were talking about, this community of physicians, this community of research, this access to all of this wonderful information to help people is just so important.
Let me answer that question through my own prism if I can.
Okay.
I entered oncology in 1990, and the paradigm of care was all that mattered was the patient in front of me. It was me and the patient. That's what I was taught, and that was the paradigm. And the fact that patients had to struggle to get care by finding their doctors, bringing their records, copying papers, and advocating for themselves, and not knowing where to turn, and not knowing what to do, and being left to their own. It was a standard of care. It's how things happened. Very fragmented. And everything we did was up to the patient to advocate for themselves and get done. There were very few centers in the country that really excelled. The number of specialty centers was quite small, and patients had to travel to get nuanced care. What's happened over the last 35 years? A tremendous diaspora of knowledge. There's a democratization of standard of care, optimal standard of care everywhere, quite frankly. This consolidation of cancer care delivery within a system. What does that mean? It means that patients can get all their care within one organization in a more nurturing way. They're helped to navigate rather than having to navigate it. But really what I think is special about Rutgers and RWJBarnabas is they take it to the next level. If you think about, I think about, but I see how they plan and how they try to execute what they do. They're really passionate about the state of New Jersey. And I think the way that they've invested in it and the structures that we're creating is to really put our arms around the state of New Jersey. And we're seeing people coming from other states now because of this infrastructure to deliver that care, so that no matter where patients begin, they can get the same care. And we're putting in processes, not in one site, but others, that all the sites. So we can replicate what's done at one site at every site. To me is called systemness. And achieving that, to me, is a mark of a very high functioning, not just cancer center, but a health system. It sounds easy, it's not. And for me, I love being part of it because I enjoy seeing, as I've said, patients benefit, some patients who I'll never meet. So I think that's part of our culture, it's part of our strategic plan, it's part of what we're executing, and it's exciting to be part of it. It really is.
Yeah, it's really an exciting time. Okay, so I know we've covered a lot, and we've touched on the Melchiorre, but what is that one thing that you are most excited about?
No one's asked me that. I want to walk in the first day, and I want to see the faces of patients that walk in. I want them to look around, and I know I'm hoping I'm going to see what I think I will, but people who are smiling, people who don't look tense, people who look like this is where I want to be. Not fear coming in, but feeling this is a healing place, a home for their care. I want to see patients taking advantage of not just cancer care delivery, but also some of the supportive care services that will be there. There'll be a cooking demonstration arena, and I think it may come down to a throwdown with one of the other oncologists and myself, I'm told. So I'm looking forward to actually
stay tuned for that.
Actually perform well. But my point is I think that we like to put our arms around them to be able to make them feel that they really truly are cared for in a setting that's therapeutic. I want to see them actually light up. And I'd like to hear their comments, because if we can continue to deliver that and even elevate the level of care and research we can provide, which I think we will, because we'll have more space, we're crawling over each other, but also add that extra happiness factor for the patients and their families. They're stressed too. I think that'll be the most exciting thing for me.
We've asked, I mean, a little emotional, we've asked that question a lot, and that's the first time no one's given an answer like that. That was really good. That's why he's so great, everybody. That's why he's so great.
I learned a long time ago. So I gave a talk one time. I'm a breast cancer doctor. And somebody asked a question in public, and it was being televised, and they said, Dr. Raptis, why do you do what you do? And I had a lot of answers I was trying to pull together. Being a breast cancer doctor, out of nowhere, it just popped out of my mouth. I said, I have 4 daughters and a wife. And I realized not only caring for people with breast cancer is important to me, but if I don't participate in research that changes the care or the paradigm, that statistically right now there's over a 50% chance one of these women in my direct life will be affected by this. And it's hard for me to live like that. So I take that to heart, in that all of us, anyone who touches cancer patients, it's not a job. It can't be a job. You have to be emotional about it, because it happens to us. There are physicians that we work with, other support staff, nurses who've had cancer or have cancer. It's personal, and it can't stop being personal. So to me, I think that, again, for many of the physicians I work with, I think they think of that, and we talk about that, and it's about the community, and that's really special.
I'd be remiss to not ask you, we're approaching October so quickly, which is Breast Cancer Awareness Month, everybody. So this is your elevator pitch to women out there. Why is it so important once you hit that age of 40 to get those mammograms?
Well, first off, I will say that there's been confusion over the last 10 years about when to start getting mammograms. Many people may recall a number of years ago there were changes to the recommendations. People thought it was the insurance companies, it's political. No, it was a lot of data that was in flux that changed those criteria to be starting later and to have them less frequently. The data has evolved, and there's clarity now that women should start getting their mammograms at least at age 40 and some even at 35, and it should be annually. There should be discussions with their physicians, hopefully expert physicians that can guide them in some situations where it should be even earlier. I'm not going to go into it, and about the frequency and how long you continue to get mammograms. But the risk of breast cancer continues to rise continuously. It doesn't level off. And again, working with their physicians, they should be having a first mammogram at least at age 40. And why? Because it is clear it saves lives. It does not prevent breast cancer from occurring. Many people say, but I did my mammograms, I still got breast cancer. Yes, but there's data over 40 years worth of data that says it improves survival by catching it early. So please do so. I hope this helps everyone be there and get their annual mammogram and make sure that keep track of it and keep getting it annually if that's what's indicated.
Yeah, so this is your reminder. So if you just recently turned 40 or about to turn 40, or if you just haven't gone or it's your time to go, we'll visit our website. It's rwjbh.org/mammo. We'll put that in the link for you. And if you want to learn more about our the Melchiorre Cancer Center, please visit. We'll also put this link for you, rwjbh.org/CBMC Cancer Center. That's all. We did it.
And thanks, and get involved. Anytime you can get involved and be part of this, we would be so happy. Volunteers, visitors, learn about us. Please give us feedback. We're always trying to do better for the community. Thank you very much for joining us.
Thank you. We appreciate
Thank you.
Bye, everyone. Till next time.